Today let's talk about female puberty. I'm Dr. Neeraj. Puberty is a nuanced orchestration of hypothalamic pituitary gonadal axis with distinct clinical markers. The neuroendocrine trigger of puberty begins not with physical change but with awakening of the GnRH pulse generator of the hypothalamus. After a period of childhood quiescence, there is a decrease in sensitivity to the negative feedback of sex steroids and an increase in excitatory inputs like kisspeptin. The first thing that occurs is an adrenarche, which is the prelude and often occur independent of the HPG gonadal axis. It occurs around 6 to 8 years, where the zona reticularis of adrenal gland increase in size and start secreting weak androgens like DHEA, DHEAS, and androstenedione. The clinical sign is the development of an axillary hair and a change in the order of sweat. Note that adrenarche is distinct from gonarche and one can occur without the other in certain diseases. The clinical sequence in gonadarche is 95% of the females is the same and follows a predictable bottom-up hormonal cascade. The first is thelarche, which is a sentinel event. Usually the first clinical sign in thelarche is the pulsatile is rise in the pulsatile FSH and LH, stimulating the ovarian estradiol production. This is followed by the Tanner stage 2 of appearance of breast bud. Typically occurs around 8 to 13 years. The mechanism is estradiol promotes the growth of mammary ducts and the deposition of adipose tissue there. This is followed by pubarche, the development of pubic hair. Typically follows thelarche by about 5 to 6 months, though in some it can be a presenting sign before thelarche. The mechanism is both are driven by both adrenal androgens, which is already there in adrenarche, and the raising ovarian androgens. This thing happens. The next stage is the peak height velocity. So unlike males who reach their growth spurt later in puberty, females usually reach this 1 to 2 years earlier, usually during the Tanner stage 2 and 3. And the growth rate can reach about 8 to 9 centimeters per year. The mechanism is a synergistic effect of GH-IGF-1 and the rising estrogen levels on the epiphyseal plates. These three are followed by menarche, or the first final milestone, which is the first menstruation, which is a relatively late event and occurs an average of 2 to 2.5 years after the thelarche. Now coming to Tanner stage, this usually occur in the Tanner stage 4. Early cycles are often anovulatory due to immaturity of the positive feedback loop required for the LH surge. It may take 1 to 2 years for regular ovulatory cycles to establish. We know this by asking the subject whether the girl is having painful menstruation. Usually, anovulatory cycles are painless compared to ovulatory cycle, which will have some amount of painful cycles or dysmenorrhea. So that's how normal female puberty proceeds. Now, if you see a patient with menarche occurring before the growth spurt, it should raise a red flag for potential pathology. Example, precocious puberty with advanced bone age or peripheral sources of estrogen. So this is how normal female puberty occur in sequence.